right, so we have an ingrown again today. So you can see with this patient, she's got this overriding toe. So what happens is the toe puts pressure on the nail forces in the skin, and then it hurts. All right, she does the same thing on this side. This one doesn't hurt. So we talked about a couple different options. She doesn't really have any issues with the toe, so we're not going to do anything surgically to straighten the toe. She wears a toe spacer, which is really the best option for her. So we talked about two options. One is just removing a larger chunk than usual of the nail to get rid of the ingrown, which will help, or taking the whole nail off. So we chose to go with the lesser aggressive option, where we take a chunk of the nail, leave still some nail so she can still paint it and have a portion of a cosmetic appearance to it. So if for some reason it bothers her again down the line, then at that juncture we'd have to take the whole nail off. You can see on this one over here, the way the toe hits, it actually doesn't bother the nail because it's more directly on top. So that's ideally really the goal we're going to look at here. So get it fixed up. So we do have patients that come in with similar issues, you know, whether it's ingrowns because of bunions or hammer toes. So, you know, it's one of those things where just because you have a bunion or hammer toe doesn't necessarily mean you have to, like you said, take care of the nail without having to fix the bigger bony problem, you know.
I remember my aunt she had she had big old bunions. She used to wear these shoes with
People will do that, yeah.
Sticking out the side.
It's funny. Yeah, you can tell some people just get to the point where like, you know what, I don't care anymore. This doesn't hurt, I'm gonna make it work. You know? No.
There's nothing worse than sore feet.
Yep. You're right.
We all take it for granted.
Absolutely.
And I think of all the years, you know,
Fancy shoes. Right. Yeah, you know, in retrospect, you know, it's coming back to bite you. Right?
Yeah.
It'd be a good ad for all the current women that are working up in New York City on Wall Street or wherever else, you know.
Well, shortly after I left,
So again, for this one, we took more than usually we would because of the fact that the way the toe is hitting, right? So that corner won't bother anymore. This will heal in. So really, when the toe sits, right, you really won't be able to tell that she's missing a part of the nail, and more importantly, it won't hurt her. So that's what we want. All right, all done.
yeah.
Quick and easy, right?